Get paid, young nurse, get paid. Get paid, young nurse, get paid. Get paid, young nurse, get paid. It's your man CJ Kyles checking in once again, back with another video. And I am a licensed practical nurse, and most of this channel is dedicated to nursing, but sometimes we talk about other stuff. But this is a nursing video, ladies and gentlemen. And before we get into the video topic, make sure my mouth ain't crusty. Before we get into the video topic, please hit that like button, that subscription button, and notification bell so you don't miss any of the content. You dig? All right, ladies and gentlemen, it's getting real interesting in these nursing streets, if you will. Very, very interesting, to say the least. To make a long story short, there is a shortage. These hospitals are filling to full capacity. People need help. These hospitals need help. These hospitals have gone so far to start hiring felons. Yes, felons. And I know personally of somebody who now works in the hospital as a felon. They're not a nurse or anything, they're a transporter, but a felon nonetheless. That's unheard of. And we are really in some different stuff right now in these nursing streets and the nursing game. But this video in particular, we're talking about a hospital here in Michigan calling the U.S. Army, bruh. The U.S. Army to help deal with this whole situation that we got going on right now. So I'm gonna read y'all the article. Clearly, as y'all see, I'm not in my studio. I'm actually at work on lunch, and I just thought it was the perfect time to bring y'all this information. You feel me? It says Beaumont Dearborn gets U.S. Army to help deal with COVID-19 surge. A team of 23 military nurses, doctors, respiratory therapists, and other personnel have been stationed at Beaumont Hospital in Dearborn to assist with COVID-19 as coronavirus cases swamp hospitals across Michigan. The U.S. Army contingent is part of the federal response to a fourth surge of coronavirus that is sweeping the country, fueled by the Delta variant, even as yet another potentially dangerous iteration, Omicron. If I'm saying that right, y'all know that sounds like a whole movie or something like that. But Omicron was identified this week in California, Minnesota, New York, and Colorado. It's getting serious, y'all. Got the whole Delta variant, this new Omicron, you know what I'm saying? Nurses are coming in from the Army. It's getting wild. It's getting real wild. Something that we have never seen before, especially healthcare professionals. We've never seen this, but they say every 100 years, something like this happens. So I think the last one was like the Spanish flu. So let me continue with the article. Currently at Beaumont Health, we have about 620 COVID patients throughout the health system. This is on top of all the normal traditional care that we provide at this time. David Clays, co-CEO of the 8 Health Hospital System and president of Beaumont Dearborn Hospital, said at a Friday press briefing that it's about a 200% increase in COVID patients since September 30th. 200% increase, bruh. About 80 of the Dearborn Hospital beds have been closed due to lack of enough staff. Wow. Of the hospital's 500 available beds, 110 are occupied by COVID-19 patients. We are concerned that the exacerbation and surge in COVID will surpass last year's at this time, as well as March 2021 surge. That's a great concern for us. Both emergency rooms and medical surgical units and intensive care units across the systems are at or near capacity, taking care of both non-COVID and COVID patients. Michigan added a total of 18,443 cases Thursday and Friday, with 277 deaths, according to the latest number from the Michigan Health Department and Human Services. This addition brings the state's total to 1,336,566 confirmed cases and 24,367 deaths from the virus since the pandemic began March 2020. Michigan hit a new record of adult hospitalizations from the virus Monday, with 80% of all hospital inpatient beds full, according to the State Department. Man, this is getting crazy. This is crazy. Lieutenant Stephen Duria, I'm sorry if I'm mispronouncing that, but the officer in charge of the U.S. Army's medical response team said they're in Michigan as part of the Department of Defense ongoing COVID-19 operations and cooperations with the Federal Emergency Management Agency. This team includes 14 critical care nurses, 4 doctors, including 2 internists and 2 pulmonary care physicians, 2 respiratory therapists, and a 3-member command and control team. Our job is to support FEMA and be able to be here for what the hospital needs. We're proud to be here and a part of the whole government response. The medical response team will remain in Beaumont for about 30 days. And other Michigan health systems have applied for similar Department of Defense assistance, and those requests are under discussion by state and federal officials. The U.S. Army recently completed a similar 2-month mission in Mississippi. Generally, our team will be assisting in the ICU and an emergency department to reduce patient ratios and certainly provide better care. So hopefully, if somebody's infected by COVID, they can have a better outcome. The assistance is part of the U.S. Army North COVID-19 Hospital Support, a joint military operation that began August 2021, according to the press release. The effort is funded by the Department of Defense in support of FEMA and U.S. Department of Health and Human Services. Wow. So far, approximately 435 military personnel from the U.S. Army, Air Force, and Navy have helped treat COVID-19 patients alongside civilian health care providers and hospitals in Alabama, Arkansas, Colorado, Idaho, Louisiana, Michigan, Minnesota, Mississippi, Montana, New Mexico, Tennessee, Utah, and Washington. It's getting real. It's getting really real. Here's my thought. They need to put some sort of initiative on placing major priority on getting students through nursing school. I'm going to be so real. I'm going to keep it so real. Take the glasses off, you know it's serious. No, I'm just playing. But for real, I'm going to keep it real. LPN school should not take 1 year. I'm gonna keep it a buck. You need about maybe 2 months of book work, and the rest you need about the rest of that's clinicals. All your experience is gonna be on the floor. You feel me? Like, it's so unnecessary to be in school for a year when it comes to LPN, and I feel like it's probably the same with being a registered nurse. I'm sure you don't need 4 years of school to be a good nurse. I'm sure maybe 1.5 years, maybe 2 years max to be a registered nurse. Because like I said, your experience is going to come from the floor. A lot of that stuff is fluff. These people need experience on the floor. Healthcare professionals have to get experience on the floor. And right now, we are in a state of emergency. So, what I think they should do, I think they should take the LPNs who are willing to go work in a hospital and let them train, let them work, let them shadow, and let them become registered nurses. I would say after 6 months of clinical experience on the floor. I know a lot of y'all gonna be like, "What the?" That's what I think. Let them become registered nurses after 6 months of clinical experience on the floor, because they need the help. They need the help. Make them sign some sort of contract to go back to school and finish what they need to finish. But yes, I think they need to start pushing these people through because you need the help and people have to gain experience. The fact that I have to wait, that I'm on a waiting list till 2023 to get in the nursing program is ridiculous. I don't mind, but it's still ridiculous because they should be doing them programs like that. They should be moving them programs like that. It is absolutely absurd. And their excuse was, well, we don't have the staff. Bull. I don't believe that. I don't believe that at all. That's BS. I think it's a money thing, to be honest. But the way they're asking people to come to school, people not coming the way they used to. So I think it would be in their best interest to try, especially from a state and local level. I think it would be in their best interest to work with the schools and the hospitals, come up with some sort of program where the LPNs are willing, they can become our registered nurses in 6 months, and they need to expedite these other nurses on through school. Send them to the floor. Once they get about a month, 2 months of book work in and learning everything that they need to do, put them on the floor. I'm sorry. Maybe I'm talking crazy, and maybe some of y'all disagree, but something gotta give. Something has to give. You know what I'm saying? And this thing is probably gonna be here for a while. It's going to be here for a while. And like I said, something has to give. Like if they offer me a deal like that and they say, hey, come work at this hospital for 6 months, we will give you your RN license, right? You have to sign a contract to work with us for, I don't know, one year, maybe 2, I don't know. We'll pay for you to go back to school, but we're gonna expedite your RN license. I'll be game. I will go back on staff for that. Just for the experience. Because just think, when this dies down and the experience you're gonna have from working in that condition, you're gonna be a top-notch nurse. You did, because you became a nurse at the worst time in history. I mean, who would have thought? You did? So I don't know. Let me know how y'all feel in the comments. Am I tripping? I don't know. Let me know how you feel. Leave a comment, hit that like button for the YouTube algorithm. And until next time, ladies and gentlemen, I bid you adieu. Deuces.